Hi everyone, Richard Armour here, Paramedic Practice Leader within BCEHS Medical Programs. It's been another big month for clinical practice with a number of new practice guidelines and initiatives to support paramedics in delivering high-quality patient care. We'll start in Community Paramedicine, where this month there are 2 new practice updates. First off, we have a new clinical practice guideline supporting community paramedics to initiate subcutaneous butterfly access for patients who undertake self-administration of subcutaneous medications within the community. At this time, CPs will not be able to administer medications other than saline flushes through these lines, but work is underway to identify high-value therapies CPs may be able to support patients with within their scope of practice. At this time, it is expected this practice development will allow CPs to support palliative care teams with the management of palliative patients in the community. More information regarding the education to support this will be sent directly to community paramedics in the coming weeks. Also, in response to a number of community requests, we have also developed a clinical practice guideline to support community paramedics administering vitamin B12 injections to patients within the community. Community paramedics will be required to complete the BCEHS Administration of Vitamins in the Out-of-Hospital Setting course on the Learning Hub and apply for their EMALB Schedule II endorsement prior to providing these therapies. Moving on to some developments in secondary triage and clinical consults. Over the coming weeks, a new dedicated queue for secondary triage will be implemented within CAD. This will stream 10 yellow events for conditions such as abdominal pain, back pain, dizziness, weakness, other pain, general illness, and vomiting to secondary triage clinicians for enhanced assessment prior to ambulance dispatch. While some of these patients will require face-to-face assessment and care, it is hoped this process will assist in connecting patients with the right care the first time. To support this initiative, video teleconsultations using GoodSam have been implemented in the Clinical Hub. GoodSam allows secondary triage clinicians to improve their assessment of patients with low acuity illness or injury, and will also be available for paramedic specialists when providing clinical consultations. This will shortly expand to include critical care paramedic advisor consultations for auto-launch assessments, so watch this space for more and continued innovations. As of today, there is a new STEMI clinical pathway for primary care paramedics working in the Sea-to-Sky corridor who have been trained and equipped with LifePak 15s. More information regarding the pathway is available on the handbook. However, this pathway enables PCPs who identify a patient with STEMI in the Sea-to-Sky or North Shore region to transport the patient directly to St. Paul's Hospital if within a 60-minute drive time. Also beginning today is a new Assess, See, Treat, and Refer pathway in Vancouver Coastal Health for patients with non-traumatic lower back pain. These patients can, at times, be safely managed by urgent primary care centers with no imaging or lab work, and so a clinical pathway has been developed to support paramedics connecting patients with the appropriate care. It is anticipated this pathway will be available to paramedics in other health regions soon. The clinical pathway includes details regarding assessment of these patients. However, it is important to remember the red flag symptoms associated with back pain, which suggests the need for conveyance to the emergency department rather than an urgent primary care center. These can be summarized with a helpful mnemonic of tuna fish. This is trauma, unexplained weight loss, neurological symptoms, age over 50, fever, intravenous drug use, steroid use, or history of cancer. These patients are at an increased risk for high-risk presentations of back pain, and so may require imaging or blood work beyond the capability of the urgent primary care centers. Prior to conveyance to an urgent primary care centers, paramedics must consult clinical for triage and registration at the urgent primary care center. There are some additional practice reminders in the full update regarding compressions and ventilations at overdose prevention site, ACP LifePak 15 updates, urgent primary care center pathways in the Lower Mainland, and trauma assessments. I would like to take a quick moment, though, to thank all paramedics for distributing over 2,800 take-home Naloxone kits in 2021. Particular thanks to White Rock, Courtney, Vernon, Terrace, and the Downtown East Side stations who distributed the most in their regions. Take-home Naloxone kits can be ordered through the Provincial Logistics Order Form by any unit chief and every station should ensure they have a supply for distribution as the opioid crisis continues to worsen. Thanks for taking the time to watch this update video, and we're looking forward to more updates next month.